My name is Miodrag Mitic, and I'm the managing partner of the European Traceability Institute, which is an independent private consultancy based in Brussels, Belgium. Let me introduce myself. I have been developing supply chain standards, designing and implementing traceability solutions for the last 20 years. I am the convener and first chairman of GS1 Healthcare, which I had established in 2005 when I was a senior executive at the GS1 Global Office. I won the 2009 Technology Pioneers Award from the World Economic Forum when I served as vice president of global development at TraceTracker Innovation, which is an international traceability software company, which was an IBM and SAP partner. Amongst other professional activities, I was appointed by the European Commission to the DG Health and Consumers expert group on product traceability. The European Traceability Institute is a consultancy which assists organizations worldwide to implement traceability systems and profitably provide safe and sustainably made products via efficient supply chains. We're specialized in implementing GS1 healthcare standards, automatic identification technologies, and traceability software solutions. Our integrated traceability management model, which we call the ETI model, Trace Certified Program, and associated services are designed to be used as tools that enable organizations to do the following: provide a common vocabulary and way of thinking that facilitate effective authentication and traceability capacity building, both within and outside the organization, assess where an organization is, helping it to understand its key strengths and weaknesses in the areas of authentication and traceability, and implement technologies and solutions appropriate to their corporate needs and integrate existing initiatives, removing duplication and identifying gaps. My presentation will address the growth of falsified medicines and counterfeit pharmaceutical products, as well as the measures to protect manufacturers, wholesalers, and pharmacies against counterfeiters. I will specifically address the detection, investigation, and prosecution processes, as well the relationship between serialization, authentication, and traceability. Because of the lack of regulations and their enforcement, the quality, safety, and efficiency of both imported and locally manufactured medicines in many countries cannot be guaranteed. This is today widely recognized as a threat to society in more than one way. Patients' health is at serious risk from fake medicines. Governments, and by extension all of us as taxpayers, suffer fraud against the medical insurance system, and medicine manufacturers, pharmacies, and healthcare providers face product diversion, liability issues, and financial loss. The motive for falsifying and counterfeiting medicines is the extraordinary profit that is a result of the difference between the costs of producing fake medication and the price charged for it. I would like to stress that this is a criminal activity that is annually worth tens of billions of euros in illicit profits generated worldwide. Falsifying and counterfeiting medicines is a criminal act, and the fight against it therefore requires action from lawmakers, law enforcement agencies and courts, the pharmaceutical supply chain participants, as well as patients and consumers. As in fighting all crime, this is an ongoing battle. The European Union Falsified Medicines Directive aims to prevent falsified medicines from reaching the patients by introducing harmonized pan-European safety and control measures. It calls for a unique identifier on the outer packaging that allows verification of the authenticity of the medicinal product. While the obligatory authenticity feature on the outer packaging is still being decided, the directive strengthens the requirements for control and inspections of plants manufacturing active pharmaceutical ingredients, record-keeping requirements for wholesale distributors, and introduces the obligation for manufacturers and distributors to report any suspicion of falsified medicines. This is a step in the right direction. While the correct and consistent implementation of this important European directive can prevent the dispensation of fake medicines to patients, by itself, it is not sufficient to win the battle against criminals. Why serialize, track and trace? Well, measures aimed at deterring counterfeiting are an important milestone. With this in mind, my position is that the primary purpose of serialization, authentication, and traceability of medicines should be to enable detection, investigation, and prosecution of criminals. Specifically, number one, detection of falsified and counterfeit medicines. Number two, investigation into their origin and how they're introduced in the retail supply chain. And number three, prosecution of the criminals responsible for their manufacture and distribution. It is my view that all anti-counterfeiting methods and technologies under consideration should be measured against their contribution to these objectives. Detection. Let me address the issue of detecting falsified medicines, which is the logical first step in fighting criminals who manufacture and distribute them. Professionals who dispense, administer, and inspect medicines should be able to easily authenticate the original product and detect and distinguish it from a fake one. While there are numerous detection methods available today, they should be viewed in a dynamic perspective because most anti-counterfeiting measures degrade over time. This is due to the wide dissemination of technologies and availability of low-cost equipment used to create anti-counterfeiting measures. In other words, most anti-counterfeiting measures will be replicated by criminals in their due time and thus become ineffective. Take the example, the story of the hologram, which was first introduced by Glaxo in 1989 on their Zantac product. Holograms have appealed to manufacturers due to their low cost, flexibility in manufacturing process integration, and instant and easily recognizable primary feature identification by patients and consumers. In general, holograms have two sets of security features. The primary feature consists of overt patterns, easily inspected by the naked eye. Such features include the general radiance of a rainbow hologram and intricate designs. The secondary covert features provide well-equipped authenticators with a means to obtain additional confidence of the hologram's genuineness. This often entails the use of specialized readers, such as polarizing sheets, ultraviolet radiation, or chemical reagents. Nowadays, almost anyone can get a hologram printing machine at a reasonable price, or simply order duplicates of a master hologram from dozens of hologram making companies throughout the world. The result is that counterfeiters are applying knot-off holograms on their products, making it almost impossible for the average person to tell the difference between a real and fake hologram, and thus a real and fake product. Anti-counterfeiting measures. The current best practice advises a multi-level approach to anti-counterfeiting. At the first level of security are relatively simple, overt packaging features that are primarily intended to enable product authentication by non-security experts, such as healthcare professionals, pharmacists, and consumers. At the next level of security are covert features, and there is a wealth of highly sophisticated technology available. Let me mention some of them and discuss a few. Secure inks. Thermochromic ink responds to heat by friction or other source, disappears or changes color. Infrared ink becomes invisible or shifts spectrum when exposed to infrared light. Ultraviolet ink becomes invisible or shifts spectrum when it becomes exposed to ultraviolet light. And chemically reactive ink is basically an invisible watermark which is revealed with a special authentication pen. Secure labels and glue. We have the tag and glue, which is an embedded tag and read by a probe contained in the glue. And ultraviolet glue is a suspended UV-sensitive element which appears when exposed to UV light. Secure printing, microprinted, raises the cost barrier to counterfeiters with the small type size. Color shifting, it's a shifting ink that changes the spectrum based on the angle of viewing. Holographics are three-dimensional images shift based on a viewing angle. Layered printing has hidden layers that are revealed through various activation methods. Ultraviolet fibers are basically embedded fibers that become visible when exposed to UV light. Machine-readable threads are digitally encoded threads readable with a decoder. And taggants is information contained in encapsulated taggants. I would like to give you an illustration of how some of these methods work. Taggants are uniquely formulated microscopic objects covertly incorporated in products or their packaging. The assurance of security lies in the difficulty or cost ineffectiveness in reverse engineering tagged particles and the distinct decoding signatures they produce. Popular tagged products offer a proprietary combination of micron size, inert or rare elements, or fluorescent fibers. These items are either added to the packaging manufacturing process or sprayed onto the finished product prior to leaving the factory. Verification occurs via readers ranging from UV lamps to stereo microscopes or complicated synthetic DNA ink pens or energy meters that respond to proprietary fluorescent signatures or magnetic responses sent by taggants reacting to electric fields. The strong, non-duplicable characteristics of these products offer a high level of protection. Improvement in laser scanning techniques also allow manufacturers to uniquely identify products by imaging microscopic deformations on the surface of packages. The distinct microscopic patterns are a result of a minute manufacturing differences on a per-item basis. One can interpret such natural randomness as a product's fingerprint. Surface fingerprints can be captured by measuring the sprinkle backscatter from an image laser beam scanned over the surface of interest. Upon rescanning the same section, a distinct spike, or the lack of it, in the cross correlation can indicate positive authentication or otherwise. Laser surface mapping is very rapid, with some vendors claiming up to 300 scans per second or more. It also doesn't require any modifications to products packaged with a flat surface. Analytic chemical methods are the ultimate medicine tests because we can determine with a high degree of certainty if a sample is truly as specified by a manufacturer. Using spectroscopy, it's possible to examine the chemical composition of all components over pharmaceutical dosage, APIs, fillers, dyes, coatings, to create unique spectrum or chemical fingerprint representing the specific authentic material. Any slight deviation from the original formulation will lead to a detectable change in the measured spectrum. Forensic tests are designed to provide conclusive evidence via sophisticated methods that constitute evidence admissible in the court. These tests can be expensive to administer, require well-trained staff, and costly equipment. However, they're the ultimate and best way of testing for substandard and counterfeit formulations. Let me emphasize a word of caution. As an anti-counterfeiting technology matures, costs decrease and know-how disseminates worldwide. And this allows counterfeiters to manufacture even more sophisticated products, prompting the need for a continuous cycle of innovation. A way to break this cycle is to establish a national or international authentication system to detect fake medicines. Serialization and traceability. Mass serialization entails marking individual items with unique codes and equipping pharmacies with barcode readers. The barcodes are then used to retrieve information on the product, typically from a centralized database. If a genuine code is entered, the system confirms the authenticity, while a false code, suggesting the presence of a fake product, will prompt a warning message on the screen. The system logs each product query and rejects multiple entries of the same code at predefined levels. Should multiple unauthorized queries be made, this would certainly integrate trafficking of a fake medicine. By using a traceability system, the location of all genuine products can be determined via a record indicating the chain of custody as the medicine makes its way from one point to another in the distribution chain. This is an important system feature required to protect manufacturers against liabilities derived from purchasing or administering counterfeiting products with their brand names. While the ESM and EDQM serialization systems may be capable of enabling detection of a falsified or counterfeit product before it is dispensed to the patient, they cannot be used to identify its origin and entry point into the legitimate supply chain. Instead, a traceability investigation has to be initiated to identify the source of illicit medicines. Traceability is defined as the ability to follow the movement of a product through specified stages of production, processing, and distribution. To achieve traceability, each product needs to have at least a unique identifier, which is attached to the product at a given point in time, and a record, which includes information about where, when, how, and by whom it was made or handled. In addition, traceability requires a business to have a record-keeping system to identify how production and distribution batches are split and combined within a business to create particular products or new batches of product. And traceability requires the ability to establish a link between incoming and outgoing product batches and respond to queries about the origin and location of each production batch. A traceability system may be considered as a record-keeping system that shows the path of a product from suppliers through intermediate production and storage steps to the final consumer. It is a powerful tool for achieving a number of different objectives by connecting physical movement of products with information about them. Since technology and solution providers have jumped at the opportunity to market their services in response to traceability concerns, they have created some confusion regarding the difference between supply chain visibility, traceability, and transparency. So let me set the record straight. Visibility is concerned with the knowledge of the identity, disposition, quantity, location of finished products. It is primarily a supply chain management application. Traceability additionally requires knowledge of the product movement history between organizations, batch composition of products and ingredients, and attributes related to traceability system objectives. And traceability is primarily a quality and safety management application. Lastly, transparency implies full knowledge of all the physical, process, and other attributes of a product, and it is often demanded by consumer rights advocates. Visibility and traceability systems are complementary and work in tandem. Modern supply chains operate with low stock and an automated plan, order, receive, produce, deliver, invoice, pay, replenish process. With the information about inventories, sales, and forecasting shared in real time through information networks running the full length of the supply chain. Visibility plays a key role in efficiently managing supply chains. It provides information that enables business processes to be executed more efficiently and improve supply chain performance. Traceability is an integral component of any product quality and safety management program, which makes it possible to trace a safety or quality issue to its source, track the distribution of unsafe items, and recall them from commerce and supply. Quality management systems contain two logical components. First is the proactive component, which is a hazard analysis required to establish effective control measures and strategies to ensure hazard control. And second is the reactive component, which is a traceability system required to determine which products must be recalled and which products are safe when a quality control system fails to prevent a hazard from occurring. Since zero risk does not exist, and even the best designed safety and control system is prone to fail, traceability is required to limit the extent of the financial damage, legal responsibility, and bad publicity resulting from a quality incident and product recall. In order to achieve traceability across the medicine supply chain, all the parties involved must achieve internal and external traceability as a prerequisite for the traceability of the entire supply chain. Internal traceability consists of following the movement, ingredient or product through the storage, transformation, and transport processes within a single business. External traceability consists of tracing back an ingredient or product received to its direct source and tracking it forward to its direct recipient. This is the so-called one step up, one step down traceability principle. Whole chain traceability. In addition to internal and external traceability, whole chain traceability is the ability to trace product information through all the links in a supply chain. In other words, the relevant information all businesses involved in the making of a product and distribution of a product receive and provide. Whole chain traceability consists of linking internal traceability across companies to report the path of a product from ingredient suppliers through intermediate production and storage steps to the final consumer or a patient. The critical junctions in a whole chain traceability system are the links between the upstream suppliers, manufacturer, and downstream distributors' internal traceability systems. Whole chain traceability is attained only when the upstream suppliers and downstream customers' traceability systems are linked to the brand owner's traceability systems. Product tracking and product tracing are actually the two directions of tracking forward a product and tracing it back. While many medicine manufacturers have the ability to track and trace products one step up towards the immediate ingredient intermediate suppliers and one step down towards distributors, they seldom have the ability to link internal traceability across their supply chain partners. The ultimate aim is to successfully prosecute the criminals responsible for the manufacture and distribution of falsified or counterfeit medicines. We can drive fake medicines out of the authorized distribution chains by introducing authentication and traceability measures and by educating healthcare professionals, pharmacists, and consumers. In many ways similar to the steps undertaken by the financial and banking industry to drive out counterfeit banknotes from circulation within financial transaction and bank deposits. As a result, the authentication and traceability measures will drive fake medicine distribution towards non-authorized distributors, such as small shops, street markets, and websites. Similar to the fight against counterfeit banknotes, it is up to the police and courts to do their work and prosecute criminals who manufacture and distribute fake medicines with the full cooperation and assistance provided by the healthcare industry. The primary purpose of serialization, authentication, and traceability of medicine should be to enable, one, the detection of falsified and counterfeit medicines, two, the investigation into their origin and how they are introduced in the retail supply chain, and three, prosecution of the criminals responsible for their manufacture and distribution. All anti-counterfeiting technologies mature in due time, allowing counterfeiters to manufacture even more sophisticated products and prompting the need for a continuous cycle of innovation. A way to break this cycle is to establish a national or international authentication system to detect fake medicines. While the proposed serialization system, when correctly implemented, is definitely capable of identifying a falsified or counterfeit product before it is dispensed to the patient, it cannot be used to identify the origin and entry point of a falsified product into the legitimate supply chain. Instead, a traceability investigation has to be initiated to identify the source of illicit medicines. In order to achieve traceability across the medicine supply chain, all the parties involved must achieve internal and external traceability as a prerequisite for whole chain traceability. Whole chain traceability can be achieved by choosing one of several options available to us.